ask you the preliminary questions, like about your diet and everything. How's that been? Not the best, okay. Okay, well, you cut out most things. You're having trouble with the dairy, but at least you cut out most sugars. You know, probiotics, prebiotics, and things like that. That's wonderful for you. You're gonna start taking apple cider vinegar shots soon. Yeah, definitely. I would definitely recommend that daily, because you know how I am. You got to start with the inside of the body in order to fix the outside. You know, our skin is our largest organ. Our scalp is a part of our skin, and it can be affected by things in your gut and your insides. So, you know, that's always the best bet, is to figure out what you can do internally to fix the external. But I'm really sorry to hear about, you know, the itching. You've been scratching it a lot. Yeah, okay, let me do some examination. Because I can see right off the bat, yeah, your hairline is like the main problem, okay? Whoa. There is a lot of flakes. I will say it's a lot more than usual from the last time I saw you. But again, you know, like you said, you may just be super sensitive to dairy. You know, cutting out the sugars and everything may help, but if you're still eating the dairy, especially, I understand the cold weather, you want lots of soups and mac and cheeses and pastas and all the holiday drinks. You're like, right, it doesn't help just being so tempted. So I definitely understand that. Okay. Yeah, lots of flakes. Okay. So I'm definitely gonna have to do my part getting those out, so I can do some treatment on you today. And also, it's okay, nothing to be embarrassed about. I myself am dealing with, you know, flakes and eczema because of my diet as well. I'm the doctor, and I still don't listen to my own advice sometimes, as well as you forget the weather. Okay. Right, extremely cold today. The wind's blowing crazy. It's literally not your fault. Literally not your fault, hon. Not at all. Like, yeah, like you said, the diet could be better, but again, with the weather change, you know, stuff like that, it can just be a lot. Have you ever gotten an allergy test? Maybe you should get one of those as well, just to see, you know, we pretty much, you know, got it squared away that you're sensitive to dairy, but there may be other things that are causing, you know, your skin to betray you in a way. Yeah, you never know what it really could be. It could be a combination of things. Okay, so I'm gonna get started scraping out your flakes. And after we scrape out the flakes, I'm gonna assess your scalp again, just so, yeah, because it's gonna look different with the flakes off, and I just want to see if it's raw, if it's pussing, you know, things like that, just so I can figure out what's the best treatment for you today. As well as, yeah, I see your hairline. I can see a lot of that on your hairline there. Definitely will get that squared away as well. Okay. And you know the drill. It's nothing to be. This is what I do for a living. There's nothing to be embarrassed about, per se. Nothing to be embarrassed about. I can tell that you've been scratching. Some of the flakes have some dried blood on them. Not good, because that means you're creating sores in your scalp, okay? And yeah, I already can tell I'm gonna have to do a super gentle treatment. I don't want to mess your scalp up any more than it already has. Take some of that flake. Say, yep, it's fine. Just scrape them onto the floor. Have you been using any like hair products in your hair by chance? Because that can also, you know, contribute to, yeah, you always got to make sure you're checking the ingredients in the products, making sure the first ingredient is water and not like alcohol or something, because it looks to be a lot of product buildup as well. Yeah, see, this one has a little bit of dried blood on the flake. itches, but you're really just causing yourself more harm than good when you do that. Oof. Yeah, I want to wet your hair a little bit, but I also don't. I just want to be able to see the volume of the flakes and how much buildup there is. And I think I'm going to take some of these flakes and test them. Just because with scalp conditions, you're never really sure if it's just chronic buildup, intense dandruff, seborrheic dermatitis, psoriasis. Like there could be a significant there could be just, you know, you're never really sure the diagnosis. The best bet is to test the flakes because they are from your skin, so we're basically testing patches of your skin. Okay, I'm gonna work on this area. So also, are you taking your vitamins? Vitamin D, vitamin C, vitamin B12, zinc, iron. Yes, that is also tied to it. You got to make sure you're taking those vitamins. And that's something else I would recommend. You go into your doctor. Yeah, you can go to your primary care physician and ask them to give you a test, and you just want to see what levels you're low on, what levels you're too high on. That can also be a thing. It could be a hormone imbalance. There's just a lot of different things. So I would definitely recommend you do that. And obviously I was going to say yes, definitely need a follow-up appointment with me next month. So I'm like, the quicker, the sooner you can get those tests in, I'll be better able to help and assist you with your scalp issues, just because, like I said, it could be a combination of things. You never really know until you have like the full facts and the full scope of it all. But so we already know the scalp. We've complained about the scalp. What about the hair strands? Feeling a little thin. Yeah, I was gonna say that can be vitamin D deficiency, iron deficiency, especially around your edges. I've noticed they are a lot more thin than they were in the past, and especially with the flake buildup there. So yeah, it's okay. It's okay. To every problem there is a solution. Problems exist to be solved. So we will figure out the root of the issue, and we will get it all squared away. By this time next year, you have a healthy scalp, healthy hair, you know, the whole nine. Yeah, I'm gonna have to do like the gentle treatments because like I said, I see a lot of scalp scars. Which again, I know it's hard. I know you can't help it really. I see a lot of scalp scars, and I know it's hard. I know you can't really help it, but hun, like you have to start thinking about the pain you're causing yourself, your future self. Just, you know, especially when you wash your hair, you're gonna have all of these like scars and stuff, and it's just gonna burn and be itchy. Okay, I'm like, but besides those issues, I will say your hair is significantly longer. It's just about retaining that length. We have to get the scalp, you know, together. If we don't retain that length, then if you don't get your scalp together, then you can't retain that length. You know, it's like your roots and everything, you know, like soil for plants and trees. If the foundation, if the ground, if the soil isn't rich and fertile, that tree's just gonna die, that plant's just gonna die, you know. And it's like, you don't want that. Yeah, you have to think of it like that, you know. Nourish and water your scalp as much as possible. Flakes are like hiding. Why is the road so busy today? What day is it? It's Wednesday. Like, oh, already. Maybe holiday season is next week, so maybe that's also the case. Okay. Just trying to make sure I get, most of the flakes that I can see, the ones in your hair strand, the ones I can, like I said, see to actually scrape before I do your scalp treatment. It's gonna be a quick one. Like I said, it's gonna be gentle. I don't want anything that's gonna burn. I was considering it's gonna be gentle, your scalp treatment. I don't want to do anything that's gonna burn or cause you any more irritation. I was going to do put like a topical steroid on your scalp, but I'm not too sure because of all the scalp scars you have. That seems very risky. I don't want to do anything. Yeah, exactly. So it's okay. Like I said, next time. And it's also better to not use the steroids because then your scalp and everything, your skin can become dependent on it. And yeah, it's better for us to just, like I said, you get those tests done. We figure out the root of the issue, and that's that. Some here at the nape of your neck. Some. Okay. Let's go through this. Oh, there's some right here. You just angle your head for me like that. Perfect. Yeah, this one I just want to make sure I'm getting as much as I can. Sorry, I was a little rough there. Yeah, I see that. This area does look a little sore. Okay. Yeah, so I'm gonna do a gentle scalp treatment. Your scalp seems to really be in distress, babe. Okay. I'm not trying to pull on your hair. It's like some of them are causing knots. Some of your flakes causing some knots. They're a little on the big side. So yeah, I'm going to do like a foam treatment on the scalp. Follow up with like a serum, a nice gentle serum for you. Yeah, just like nice gentle. And then I'm also going to prescribe you a shampoo. I'm going to give it to you today, and you wash your hair like once a week. Make it twice a week so you can start seeing immediate results. I will want you to start using this shampoo within a couple of days. I think I got everything on this side as well. I think I got it all. I think I did. Get some more down here, the nape of your neck. And then I need to work on your hairline really quickly. Oh, there's a couple here in the middle. Okay. my wooden stick and I'm just gonna go through. Alright. Anyways, yeah, the road is so busy today. Like, the truck drivers and the people. I'm like, usually, I thought, right, I'm like, my clinic is usually, quiet area. I don't have much going on, but it's probably because of the holidays. Next week, everybody's on the roads and traveling and buying last minute things. I like the peace and quiet. That's why I specifically chose this clinic. But, can't really do anything about the traffic. It's really out of our control. So, yeah. Okay. Perfect. Okay. And one long, what's it called? Flake. There we go. Okay. So, now I'm going to work on the hairline. And that's the same thing, but instead of using this comb, I'm going to use a spoolie just because it's your hairline, right? The area is a lot more sensitive. The skin is thinner there. Your hair is a lot thinner there. I don't want to cause any breakage or anything. Okay. It's relaxing. Yeah. And yeah, I was gonna say, this is something I would recommend you do at home if you're having flakes or anything. Gently, get a nice gentle comb and gently scrape them out, gently scratch them out, not with the hands, or get a simple spoolie like I have here. A nice simple spoolie like I have here. And you can use this for your scalp if you want. Like I would use this for the parts in my braids, or on the hairline. Right, you want to do everything that's gentle. You don't want to cause any more damage to your hair. Okay. Perfect. So now that we got that, now we can start in the treatment. Like I said, it's gonna be nice and gentle, really quick. I know you're having some some emotions about everything, but it's okay. Like I said, nothing to be ashamed or embarrassed about. This is literally my job, and you're not the only one. I'm like, if I show you my scalp right now, you're gonna be like, oh my, So everybody goes through it. Okay. So let me get your treatment together, and yeah, I want you to keep this in for a couple of days before you wash your hair. It is to break down any extra buildup on the scalp, as well as provide some soothing to the scalp, as well as the serum that I'm going to give you. It's going to provide ceramides and proteins to your scalp. Yeah, like the same that's in skincare. Like I said, it's your scalp is your skin. So yeah, I'm gonna make sure we get everything together. But like I said, this is gonna break down any extra, buildup that I don't see, that I didn't get. Yeah, gonna have a little bit of a tingling sensation, more like fresh, like similar to like a tea tree oil, lavender, but it's the most gentle we have. So it shouldn't cause any irritation to, you know, your scalp sores. Maybe just like a slight tingle. Okay, yeah, just gonna use a little bit. I know it's a little intimidating. A little. I'm gonna wet it with our water just to activate the product. There we go, perfect. And now, okay, how does that feel? Little strand test. Okay, little tingles, but not anything too crazy. Okay, perfect. Now, I'm just gonna pat that in, just the excess on the scalp that I can see. And I'm gonna use my stick to make some parts, and then we're gonna nice and soothing, yeah. A little bit more, just a tad. You feel the tingle, but it's not. Yeah, okay, that's perfect. Like if it was like burning and itching, you know, causing a lot of pain, then that would be very concerning. Perfect. Perfect. And yeah, I was gonna say I don't have to put it everywhere because it naturally spreads because it's a foam. So it naturally, you put it in one spot and it naturally just like spreads out. So I just have to do a couple of pats for it to get, you know, everywhere, and then I'll focus on the hairline. Okay. Okay. So now let me put it on your hairline as well. Now I'm just going to take my hands and I'm going to gently just massage that product in and just make sure it spreads all over your scalp, okay? And then I'll apply the soothing serum. Like I said, this is more so to break down any extra, kind of like cleaning your scalp without cleaning your scalp. Yeah, like a shampooing it. Let me know if the pressure's too bad, if I'm being too rough. Like I said, I know you have some sores. Oh yeah, that's the raw place. I'll just you know, ignore that area because it's gonna spread anyway. Okay. You're doing so well. Like I said, we're gonna get to the bottom of this. And you've had disappointment before. Right? It's like you've seen good results, so you know we can fix this essentially. It just sucks that it came back, but like I said, you're not the only one. I have a client right after you, so I have a job for a reason. So to every problem there is a solution. Just massaging that. Every problem there is a solution. noun serum. Yep, so this serum is, like I said, it has like ceramides and proteins in it to kind of more so repair the scalp, like applying an oil to your scalp almost. But yeah, that's to give like an extra layer of protection, especially because I see your scalp is a little raw in some places. So it's essentially I put the serum, and as the days go by, it adds like a level of protection. It like heals your scalp. Some places may scab over. Don't pick at the scabs. Let the serum do what it do. And even like I said, I'm gonna prescribe you the shampoo. When you are washing your hair, be gentle for the first, I would say, first 4 washes. No aggressive scratching. Don't even use a shampoo brush. I know that's your first instinct to get rid of the buildup, but the shampoo, it's gonna do its job. The products I just applied are gonna do their job. Okay, you ready? Yep, I'm just gonna again, it's similar to the foaming treatment. It kind of spreads all over on its own, but you still want to make sure, I get it in as much places as possible, because it doesn't spread as much as the foam because of the consistency. Massage that gently into your scalp, make sure it gets everywhere. Yeah, and then we'll be done. Yeah, I'm trying to be a lot more gentle with this because I really wanted to stick to that scalp and create like a layer of protection, like I said. Getting that hairline as well. Doing so great, so wonderful. Absolutely perfect. Absolutely perfect. Absolutely perfect. Okay. This is the shampoo I'm gonna give you today, and you're gonna use it, and once we see how it works, I can give you a prescription for it or whatever. But it is a therapeutic shampoo, and it's specifically for scalp buildup control. It's to help clear and prevent flakes and scalp buildup, which that's what you're dealing with. It literally starts working right after one use. This is a more, I would say, universal shampoo because it's for dandruff, psoriasis, and seborrheic dermatitis. Yeah. So it kind of hits all 3 of those until we have a clear diagnosis of what you're really dealing with. Yeah. And this one, the reason why I like this, because it looks more so like a scalp buildup, but this has salicylic acid in it, which again, like I said, your scalp is just skin. So yeah, the same thing you use your skin for acne, same thing you use in your hair. Yes, it breaks down crusty, flaky scalp buildup, keeps working long after the shampoo is rinsed off, gentle enough for daily use. And that's why I say, instead of you just washing your hair once a week, because I know typically that's what curly haired people do, your hair doesn't require as many washes, up it to 2, maybe even 3 times a week. Maybe just start with 2 now. And like I said, send me pictures in the patient portal and everything. Yes, so you put it on your scalp, you lather it up, gently massage it in, fingertips, not the nails, okay, and then you let it sit. I say about a good 5 minutes before you rinse it with lukewarm water, and you can repeat that process and then follow up with a more gentle shampoo if you're choosing. But again, like I said, use this twice a week, and like butters, maybe some oils, just gentle things, right? Like grapeseed oil, gentle oils, nothing that's gonna cause any extra buildup to the scalp, okay? Right, I was like you said, you just do simple hairstyles. Maybe you just dry your hair out and just wear it like that for a couple of days, or put it in some twist. Yeah. And again, for this, the first ingredient is water, even though it's a treatment shampoo. So again, like I said, look at those ingredients and everything. Yeah. So I'm gonna give you this today. And once we see how it's all working, then we can move forward and prescribe you this or give you something stronger. But yeah, okay. Like I said, to every problem there is a solution. We're gonna figure this out. So you take this, perfect, and I'll see you later. And I'll be looking, in the patient portal for those updated pictures and comments and things from you. Okay.